Welcome to the Idaho Catholic Register Podcast, where faith and community come together. This powerful discussion will explore the intersection of faith and mental well-being, offering insights, hope, and healing through a Catholic lens.
So I'm Jody Gadamoller, and I work for Catholic Charities of Idaho. I'm a licensed professional counselor, and we're doing this to kind of give an awareness of mental health and help people to know how to recognize signs of different, illnesses, mental health illnesses, and know what to do in those situations.
Cool. Thank you very much.
I'm Christin McIntyre. I'm a psychiatrist in private practice up in the northern part of the state. And my real desire is to help equip Catholics especially to know the resources that we have just by virtue of our faith. There's so much, and that can be so beneficial in supporting mental health and living in a more rural area especially. There's such a need. There's such a need throughout the world today, but especially in some of those more isolated communities where there isn't access to therapists and prescribers. So really trying to connect dots, helping people know what resources are available to them and how they can get the help they need. And then also how they can make use of their faith.
Yep. I'm Cari Moodie. I am the Faith Community Nurse Coordinator for Saint Alphonsus. So we provide services for church members. And also, first and foremost, I'm a mom. And I have 3 children, and so we've had personally mental health diagnoses in my family and extended family, and then also within my kids' school, we had a gentleman and his life, and my children were young, and I had to, as a nurse, I had my nurse brain and then my mom brain, and I just felt like we can just do better as a society and as a mom and as an advocate for mental health. So, yeah.
Super. Well, thank you all for coming and joining us. I hear kind of a theme from all of you, and that's kind of detecting when and kind of that early signs of maybe a mental health situation. Kind of what are, just in layman's terms, not necessarily from your professional background, but what do you look for to kind of identify, hey, this may be something going on with this person?
Who wants to take that?
So I can just from a mom and being, and a nurse, when behavior and their normal activity changes, if all of a sudden they loved art and they loved going to school and loved hanging out with their friends, and then all of a sudden they're in their room, they're not hanging out with their best friend anymore, they have no desire to do the thing that they loved. And usually, we all have times when this happens, but usually if it goes over 2 weeks, 3 weeks, then you need to start asking questions and really diving into what's going on.
Go ahead.
I was going to say, I think when it comes to depression and anxiety, are the 2 most common mental illnesses, we all go through it at some time or another, but if it's to the degree where it's affecting our daily life, we can't do our normal things we do, our work, our play, it's affecting our relationships, that's when we need to seek help. And that's when it might be a diagnosable thing, whereas we might just be sad because we lost a friend or somebody passed away, and we might be able to still do our daily activities without being too affected, then it might not be a diagnosable thing.
And I'd add to that, just in terms of medical signs and symptoms of something being wrong, we look at changes in sleep, changes in appetite, obvious changes in weight, changes in what we call psychomotor activity. So if people seem sped up, if they're talking faster than is normal, if they seem to be jittery and moving faster, or if the opposite is true, if they're not talking as much, if they're not making eye contact, if they're just everything's kind of slowed down, those are all kind of physical indicators that there might be a problem.
So if you saw someone in your day-to-day life that you kind of identified, hey, something may be a little bit off. They're sleeping a little bit more. They're maybe not as excited about all the things they used to love. They're kind of pulling, withdrawing. They're sleeping a lot more or a lot less or whatever it may be. Kind of what's the next step? Like, what do you think the first thing you do is? Obviously, you don't just start calling 911. What's the first thing you do?
Well, it depends on who you are in relation to the person.
Mm-hmm.
If this is a child of mine, I'm gonna talk to them first of all and try to find out, what's going on. If it's maybe my child's friend or, the child of my friend or something, I might speak to the parent and say, I've noticed that so-and-so something seems different, is everything okay? And just offer support where I can. But it depends on whether or not you're in a position to actually be able to do anything about it. And so then for people in, parish ministry or, that if you identify something, you would want to go to the parent first and foremost if it was a child, and then possibly to the person themselves if you notice that they don't seem themselves, just reach out and offer, your concern and support, find out what might be going on.
Perfect.
In the Signs of Suicide program that it's an evidence-based prevention program for middle school and high school students, we acknowledge care and tell, just like you had said. And so just acknowledging and that there is maybe something going on, and then, like you said, taking the appropriate steps just depending on the situation, and not overreacting when, if you do ask them and they tell you and they're honest with you.
So I hear a lot of kind of bringing up the faith and the way that the faith can kind of play into mental health and kind of be a piece of kind of a tool in that toolbox to keep yourself kind of mentally together, I would say. So what are the aspects of the faith that kind of play into that are kind of the most apparent?
Well, I think one of the biggest things that the Catholic faith offers that isn't there even in Protestant belief systems, and certainly not in the secular world, is really understanding that suffering has a purpose and a value. And so there's hope even in the midst of difficult things that are happening, that God, God's will always and everywhere is our salvation. And so everything he permits to happen has some purpose, there's some way that he intends to use that for our salvation or the salvation of someone else. So defining good as God does, as eternal good, as our salvation, basically helps us potentially find purpose in everything that's happening. And where people really find themselves losing hope is where the suffering seems meaningless and they don't understand that there's hope. They don't understand the purpose behind it. So that's probably the biggest thing.
Mm-hmm.
Working for Catholic Charities, I have the luxury of most of my clients are, I'd say a large percentage are Catholic. So I am able to really delve into their faith and what they believe and refer them to people in the church if that is necessary. Maybe they need to talk to a priest, maybe they need to go to reconciliation. And so that's all part of, discerning what kind of help would be best for them. And so that I appreciate having that luxury, but that's what we're also trying to do in this education and this program we're doing in Northern Idaho, is to equip the parish staff and the priests and everybody to know when to refer to a professional, when to refer to a counselor or a psychiatrist, and when they can help with spiritual matters. So that's kind of part of our goal.
Mm-hmm. What is the overarching goal of is that really it? Is giving parish staff and priests and whoever's involved with kind of the mental health of the parish and kind of the tools, or is that really what the number one goal is there for this conference? Or
Well, I think there's a lot of goals.
Mm-hmm.
Mostly, well, correct me if I'm wrong, I think we're trying to initiate something here. I mean, because so many priests especially, but parish staff as well, just feel like they don't have anything to offer when parishioners come forward with some mental health crisis or concern. And so this grew out of the mental health team, is that what it's called at the diocese, that really wants to do something to help, wants to try to equip communities, parishes, priests to respond to mental health issues, to really be more aware of what resources there are, how to help people. So this is sort of a pilot project, really. I mean, we're equipping them with some specific things. One is the Signs of Suicide program that Cari mentioned, but also we're putting together a pretty detailed resource list, everything from local crisis centers to national organizations, things like Courage or Encourage, or healing ministries. I mean, just a lot of different things that we can bring together in one spot, one list, to give to people. But then also, again, initiating that conversation about, like, if you know your faith, it offers so much. Just our Catholic faith alone, the sacrament of reconciliation and all of the things that the parish already does to support mental health through catechesis and marriage prep and all these kinds of things.
Yeah.
So,
As far as the goals, I mean, Friday night, we're doing a general information session for the general Catholic population. So parents, just general parishioners can come Friday night, and we're doing more, general information about mental health, what kinds of signs to look for, what are the different mental illnesses, what are the statistics. And then Saturday is more focused specifically on parish staff and youth ministers to equip them to know how to handle it. The research actually shows that people of faith usually go first to their clergy, no matter what faith they are. They go to their clergy or their staff to get help first before they'll go to a counselor. And so we want to equip them to know how to handle that. And since the pandemic, that's been a lot worse. I mean, there's a lot more people coming forward and needing help. So we want to equip. That's kind of how this whole committee started, is out of the pandemic, is knowing that the numbers have increased and the parish staff are getting overwhelmed by the amount of people that they need to help. So that's how the committee started, is to do some things to help those parishes to know how to handle mental health situations.
Yeah. So I have to ask, it sounds like, Cari, you've had some specific things happen that you've dealt with in your own life. And I'm curious kind of how that shaped your impression on how to go forward and help others. Because a lot of times, your own experience is kind of the best teacher. So if you don't mind sharing kind of what you were talking about earlier.
No, sure. My grandmother suffered from, and what I believe, she was undiagnosed mental health, bipolar, but definitely had some major depressive and signs and symptoms from when I was really, really young. And so it's something that I grew up with. And so, we had conversations in our house about what just happened and, why grandma's acting this way. And so it's really been in my life my whole growing up. Part of the reason why I wanted to be a nurse, caring about people. And then just, being a mom to 3 kids and seeing statistics and then having it happen at one of the schools that my children attended was just heartbreaking. And I just knew that it just became a calling. I just could not shake that I needed to do more, not just in my own family, but for the school family and then for the community at large. And so that's when I partnered with a friend that was getting her master's in social work, and then we ended up, getting a grant and then getting permission from Bishop Kelly, and now it's in most of the Catholic schools in the Treasure Valley to really have a practical approach. And just like we were saying about our goals, really for the whole weekend, we want to be able to tie in mind, body, and spirit, and why they're all so important, and spiritual direction, along with professional counselors and professional doctors. But also, I want to be able to give people resources so that they can feel equipped to acknowledge, care, and tell in their own families, in their own self. Like, how, why am I feeling this way today? And care for your own self, and then reach out. So we really want people to feel equipped and have resources to be able to tackle this and not be scared of the unknown. So.
Yeah, I think, do you think that's kind of that fear piece has a big part to play with why people don't even reach out in the first place?
So just personally, when we very first started approaching suicide prevention in our schools, we wanted to start with parents to make sure that they knew why we were doing this and bringing it out. And there's evidence-based and research studies say that talking about it does not put the idea into the kids' heads. If it's there or it's not. And so it's just really important for us to talk about it, to get the word out, and it's kind of the elephant in the room. If you're not talking about it, that doesn't mean that it's not there. And so, but there's specific, ways of using open-ended questions, and then having resources available, and not being shocked if you're asking a direct question about their mental health. And then you might even have to ask the question of, have you thought about ending your life? You need to be prepared for what they're going to tell you, and just be honest, and just, open your heart to them, and just thank them for telling you. And then that's when you parents involved, and you get others involved and professionals involved. But don't feel like that just because you're not a mental health professional that you can't be an advocate and a help to people.
I think there still is a big stigma around mental illness. We've come a long ways, but there's still a stigma, and I think people are afraid to come. The research shows that there's this group of silent sufferers in the church who are just suffering without getting help and without doing anything. And so, yes, I said earlier, that's people of faith usually go to their parish first, but there's also a group of people who are not coming out and not acknowledging it because there's such a stigma around it. And that's part of what I think we're trying to do, is to reduce that stigma by just making people aware of it and how common it is. It's 1 in 4 people experience a mental illness, and that's the people that are acknowledging it and coming forward. So it's probably a lot more than that.
Right.
So we want to make people comfortable with seeking help and seeking resources.
And that's one of the things that I'm planning to speak to a little bit in this, is that I hear from a lot of people who are specifically worried about taking themselves or their loved one to a counselor who does not share their faith, because they're really concerned that more damage is going to be done than otherwise. They're concerned that they won't understand, that the counselor won't understand why they're still married in these circumstances, or why they practice their faith at all. So
is that a valid fear, or is it just?
Well, it might be. It is important that you do counseling. If you're going to do counseling, that you see someone who, at the very minimum, has respect for your religious beliefs. But ideally, you have somebody that shares the same anthropology, that understands that we're made in God's image, that we're body, soul composite. And so what I'm going to be talking about is that anthropology, is the traditional understanding of basically Saint Thomas Aquinas, Thomistic psychology. He understood how we were designed to function psychologically, and the things that he wrote about 800 years ago are incredibly profound and still true today. They're actually only being validated by things like modern neuroscience, neuroimaging. It's really amazing. So not only is mental health care not necessarily, at odds with our Catholic faith, but it actually, there's a beautiful integration there that can be achieved, where if we understand how we are designed to function, St. Thomas sort of wrote the user's manual, for the human person, and if we have that, then we know how to help. Depression isn't just a black box. Anxiety isn't just a black box. We can actually look at the mechanisms there and say, oh, this is the false belief there. This is the disordered emotional response. This is what's going on, and then it offers us a way to truly heal somebody. So it's, I'm really excited to share some of that.
Yeah, it seems like the Catholic faith has science and faith combined, whereas a lot of people say, oh, well, if you're a Catholic or a Christian or a religious person at all, you can't believe in science and religion, and it seems like that's completely contrary to the truth.
Because the truth is the truth, and
right.
and science is just, when we do science, we're learning about the incredible profound complexity of the way God made us. There's nothing to fear from studying that. We're just revealing the truth. So, and again, the things that were revealed to St. Thomas Aquinas so long ago, now we're seeing how true it really is. It really kind of bolsters your faith to see that, because you're like, yeah, truth is truth. It's God, how He made us.
Yeah, that's good.
I think there's a number of myths out there too, that people that have mental illness are weak, or they don't have enough faith, or there's something wrong with them, and that's what we're hoping to kind of dispel, that those myths are not true. And I think Christin will address that a lot in what she's talking about, and how getting counseling and help fits well in the Catholic Church. It's not opposing to our Catholic faith.
It seems like to me that like the strongest people are willing to admit that they're not perfect and that they need help in certain areas, and sometimes that's the real truth of the matter is, if you're just hiding, then are you really that, are you really perfect? No, you're just hiding the fact that you're not perfect.
And
so
none of us is perfect.
Yeah, everyone
Right.
has weaknesses, areas you're not the strongest, areas you are the strongest, and the beauty of the oneness of our faith is to be able to go and say, okay, I'm really good at this, but I'm not good at this. Can you help me in this area, and I'll help you in this area? And it just seems like it's a must. And I don't know if it's a cultural thing to hide it, or kind of where that came from with mental health, but
Well, it's not just mental health. It's just, when Adam and Eve sinned, the first thing they did was made clothes for themselves out of fig leaves. So it's like that ungodly self-reliance that Dr. Bob Schutz talks about. We're all making fig leaf clothing for ourselves constantly. It's our natural response to our sinful woundedness.
And in this day and age, I think it's gotten worse because of social media. Our kids, they only post the good things, right? They don't post the bad things that are happening, or the struggles, the challenges they have. And so it's our teenagers and our kids are hiding, on social media, and that's kind of the norm for them. And so trying to get them to be comfortable coming out and talking about their problems is more of a challenge, I think, today than it used to be.
yeah, it's kind of the highlight reel of your life.
Yeah.
Look how perfect everything is.
Yeah.
Well, maybe not so much.
Yeah.
So when does this event actually take place?
Friday, April 25th. I believe it starts at 6:30 at St. Thomas Church in Coeur d'Alene.
Fitting.
Well, St. Thomas
Yeah.
the Apostle.
Right, it's
but
yeah.
Different guy.
Different-
but-
same name.
Same name, different guy.
And then Saturday, it starts at 8 o'clock with Holy Mass at St. Thomas, and then it'll go into some sessions for the youth ministers and parish staff on the Saturday. The Friday night is open to the public, and then the Saturday is more specifically for staff.
So if you're in Coeur d'Alene, why should you go? Why should I care? Like if I'm a parent in Coeur d'Alene, why should I care?
Hopefully, it would be of interest and share some specifically faith-based resources and information with parents or the general public up there who may be interested in figuring out how to use their faith better, how to access faith-based resources to support their mental health, and also just to be equipped for those needs that they are become aware of in their families or in their community. So they'll have some more tools.
I was going to say, that 1 in 4 I said before is, that means 25% of people are currently suffering with a mental illness, and those people who are currently silent sufferers need to come to this to learn how to get help and how to get resources. And then that 25% has family members and friends that are concerned about them, and so those people need to come to hear about it so that they know how to help the people in their lives when they recognize these signs.
So the chances of you knowing someone has a mental health issue is probably north of 50%.
I think
least.
Everybody does,
Yeah.
and they just might not know it.
Yeah.
And we're all affected, even from celebrities that have, ended their lives or have come forward with their struggles. And so we're all affected by it, no matter what. And Northern Idaho has really high mental health and suicide risks and percentages, especially in the remote counties. And so when I was doing research just on Northern Idaho, they're really high. And so we can help each other do better.
Yeah.
And culturally, I've worked with a lot of Hispanics at Catholic Charities and probably the Native Americans as
yes.
well. There's a lot of cultural stigma to getting help. Within those communities, they even more so, they don't think that they should be talking to other people about their problems. And so we want to kind of dispel that as well. Like it's okay to do. It's not against it's not against the church. It's not against your family to talk about your problems and get help.
Yeah, and I think it's actually drastically better. I've gone to a counselor before. All of my children have gone to counseling before. So it's like, I think the idea that talking it out is a bad thing or is somehow, culturally looked down on is like, I would much rather talk it out, figure it out, and then move forward than sit in that, situation of whatever you're dealing with for years and years and years, and then you don't make any progress forward in life because you're kind of in this, you're kind of stuck in this rut, so to speak. So, yeah, I would say, from my personal perspective, I would say going and understanding what you can do and kind of what you're able to do. You're not a health professional, that's fine. You're a parent, cool. You got kids, great. You can help your kids. If your kids' friends have issues, you can talk to their parents and say, hey, here's what I'm seeing. Just wanted to let you know, I don't know what's going on, but maybe seek some help there. I'm not sure. I think if you come from a position of love on all of it, you're really not going to mess up. And so definitely, I think, knowing kind of a foundation, maybe not being a doctor, maybe not being a counselor, maybe not being a nurse, but at the same time, having kind of that general baseline of information of if I notice this, this, and this, now what? Kind of what's my first step? Who do I get involved? Where do I turn? I think is really important. So I'm glad you guys are doing it. So what would you say to kind of the parish staff? They're feeling overwhelmed. Now you're going to have all these this dossier of information for them. What's that look like? Is it a website? Is it PDFs? What is that?
So my hope is that they might embrace the Signs of Suicide program. It is really a nice boxed program for you. All of the lessons are already made up for you. They're evidence-based. They continue to do research. It's been, the program has been going since the very early 2000s. We've had it here in the Treasure Valley since 2015, so we're on our 10-year anniversary. We have, we've trained over 5,000 students. It has a middle school curriculum and a high school curriculum, and so 6th, 7th, and 8th, and then 9th through 12th. And so it really is my hope that they might want to embrace this and maybe, train the parents and then push this out to their religious education kids. And then you identify a trusted adult. You learn to ACT, which is acknowledge, care, and tell a trusted adult if you find something in yourself or in a loved one or a friend. And so they have found that it can reduce suicide attempts by 64% just by informing kids that you have permission to go tell a trusted adult. And it kind of goes through of, a lot of times kids will talk to their peers and their friends a lot of times before they're going to talk to maybe a teacher or their parents. And so this gives kids permission to tell that trusted adult and that they're worried about their friend, because and they don't have to worry about being losing their trust, because a lot of times they'll say, you promise you're not going to tell that I just told you this. And they learn that it's much better to maybe have your friend be mad at you for this short amount of time and still have them living a life. And so it's really nice to equip them, to let them know that they do have permission to do the right thing, and it is the right decision.
And we are going to have some tables of information available as well for people to pick up flyers of different resources. I think we're going to have a document that we can print off for people to have a list of resources available. The ultimate goal of this mental health committee is to have a mental health team in each parish. That's not always possible because they don't have enough people, but we don't want to overwhelm the priests and say, okay, now this is another thing you have to do. But if there's, if they can identify some people in their parish that are really passionate about this or really care about mental health, they can set up a team of people and have a mental health ministry within their parish. And so those people are trained and, maybe do a little extra education and know how to help people. That's the ultimate goal. It's not always possible, but that's what we would like to see happen.
It's interesting that we parse out mental health from just health. It's not really something that makes a lot of sense. When you think about it, it's like if your mental health is a problem, your health is a problem. And if your health is a problem, then your mental health's probably you can't break those two out from each other, I don't think. So it's funny that we kind of say it as it's this own little thing that's off in the corner that's got a stigma around it. And it's like, if you were sick, you would go to the hospital. Like if you're if you've got a cold, you're going to take medication. If you've got whatever wrong with your body, you're going to go in and take care of it. But then your mind, you're just going to let go. It doesn't really,
you're absolutely right.
Yeah,
you're absolutely right. And part of it is that, we do a much better job with medicine of knowing what the actual problem is. So we take, in medical school, we learn anatomy and physiology and, all these things to understand the way the body works. And then you get into mental health, the brain, and St. Thomas had it all parsed out. He knew the intellect and will were the highest faculties, and the emotions came from the movement of the sensitive appetites, and the cogitative power did this, that, and the other thing. But that's been lost completely.
Mm-hmm.
The modern mental health community, everybody has their own theory about cognitive behavioral theory or, internal family systems or there's all these different guesses as to how we work internally. And there's truth to all of them, but only St. Thomas had that actual user's manual for the human person. So again, something we have as Catholics that the world lacks. But you're absolutely right. It's this big black box for mental health. Mm-hmm. But medical health is this is wrong, you go take this medicine, you go have this operation.
Or at least you go try to figure out what's wrong.
Yeah.
You know what I mean? It's like you don't just go, whatever. Broken leg, I'll just
right.
We'll see if it heals on its own somehow magically. At least with the physical body, it's like you're immediately gonna go take care of it.
Yeah.
And it seems to me that if you applied that same thing to your mental health, it would probably make things a lot better.
Yeah.
Or at
well,
least you're trying, like you're making some sort of progress.
The other thing is that using the word healing in too specific a way sometimes does a disservice. I mean, again, we're a body-soul composite, and healing, I mean, a fully Catholic definition of healing is our redemption, our salvation, the reconciliation of our soul with its creator. And so that means eternal relief from suffering, not just immediate temporal relief from suffering. And so understanding healing in that larger Catholic sense is a way that we can maintain hope even when there is physical or mental suffering that we can't fix, that's beyond our ability to solve. And all of us will have suffering that we can't make go away.
Mm-hmm.
So yeah. The other thing I wanted to mention about some of the resources that we'll have to share is that there's an amazing number of truly Catholic mental health professionals in the state of Idaho. I mean, it is such a privilege to be part of this community, a statewide community of people. And there's an association that has a referral list that will have little business cards and flyers and things and information. So people that want to work with a truly Catholic counselor have a lot of options.
So for our viewers, what is that association?
It's called the Association of Idaho Catholic Mental Health Professionals.
Yes.
Okay.
And we have a website, I believe it's Catholic Therapists Idaho, or Idaho Catholic Therapists.
I think it's Catholic Therapists, plural, Idaho.org.
And there's
Yeah.
a directory where they can look up, find people in their area. But I'm on the board of that association. We're also trying to find the other Catholic mental health professionals out there. So the people that are listed are ones that have found out about us and joined the association. But I know that there's more out there that we don't know of. So if there are other Catholic mental health professionals out there who are faithful to the teachings of the church, we would love them to join our association so we can build up that directory and have more options. Right now we don't have anybody in eastern Idaho, and so we'd love to get people on there from other parts of the state.
So if you're a Catholic, person willing to join the association, I'll put a link at the bottom of the video, and that way you can find it, or at the link at the bottom of the podcast as well. We do a video podcast, so it posts both on YouTube and on Spotify and all the other podcast platforms. So there's a good chance that someone might see it and say, "Oh yeah, that's kind of me. I'm a therapist and I'm Catholic," and so hopefully we can get someone from eastern Idaho. Maybe eastern Idaho doesn't have any mental health problems at all. They're perfect.
I wish, that would be nice, but we all know that's not the case.
No? Okay. Well, maybe
We do
next time.
Catholic Charities, because we're under the diocese, we serve the entire state.
Yeah.
So I have clients from eastern Idaho that we do telehealth with. So we can serve the whole state, but I know a lot of people would like to have in-person counseling, and so it'd be nice to have some local people we could identify.
Some
that
options.
They could go to.
Yeah. Perfect.
And before we wrap up, I just want to mention that 988 is the crisis hotline wherever you are nationwide. That's a really good number to remember. But if it's harm that's physical harm, then you want to call 911. You never want to leave that person alone if they've expressed anything like that to you. So just utilize those resources if you need to.
Awesome. So is there anything that you would want to say directly that we haven't covered, Jody?
I don't think so.
Yeah.
Anyone?
Well,
If there's something that you have that we haven't talked about that's important to you, just
Well, I guess I want to return to something I think we said earlier, just that this is the beginning of a process, a conversation, of something that we want to see continue and develop. We want to ideally have these kinds of events in other parts of the state. We want to continue to have these sorts of events to equip the local communities, the parishes with things. So yeah, I mean, we'd like to hear from people all over the state what would be helpful. What do they want? How can we help?
I have a question for you. I remember I was asking the bishop about something, and he was telling me about this guy that was at his parish where he originally was just a priest, and he said the guy's name was Bill, and Bill, he'd come to Mass, he was coming to Mass with his wife, and at one point Bishop said, "Bill, why aren't you Catholic?" And he said, "Well, no one ever asked me." And he's like immediately came into the church right after that. And it was that no one ever asked him thing that kind of got my wheels turning. And it's like, is there something that we could kind of put in place so that, throughout the diocese, there's like this thing where we ask people? You know what I mean? Like, people are going about their daily lives and maybe they have a bunch of, these things that they're just hiding really well, so no one's picking up on it. How do we, like, where is it that we could say, okay, if we put this in everywhere and implement it everywhere, we'll be able to actually ask the people, like Bishop asked Bill, "Hey, do you want to be Catholic?" "Yes, I do." "No one ever asked me." Or, "Hey, are you having issues with your, are you depressed? Are you, like, what, is there something like that? Like, does that exist, or am I just crazy?"
Well, I don't know that there's any one thing that fills the need in every place, but you made me think of something, which is that I think it will be really helpful, or it would be really helpful, as Jody was saying a few minutes ago, to have a mental health, maybe not a team in every parish, but at least somebody in the parish, someone who's designated as the go-to for mental health situations that might come up. And one situation that happened with a patient of mine, not in this diocese, but I think it happens in every diocese, where they were coming into the church and they had a history of pretty severe trauma. And there are specific things that go along with having trauma, the responses that you have physiologically, mentally as well, but emotionally, but also even just physiologically. If something that's reminiscent of that trauma happens, that the person has, involuntary responses that other people don't understand, and so this person entering the church through RCIA, I mean, they wanted to have community, they wanted to recover, and the church didn't know what to do with them. Because they'd be sitting in an RCIA, well, it's OCIA, but RCIA meeting, and some random thing would happen that would trigger them, and they would, kind of have a little flip out, and everybody was like, what's wrong with them? And so instead of getting the help that they needed, that they were so desperate for, they found the church curiously ill-equipped to support them, and the person was telling me even that because they had come from the Protestant tradition, and I wouldn't have been treated like that in the church I came from. And so I do think that Catholic churches don't always do a great job of supporting people with mental health conditions. I mean, there's certainly exceptions to that, but I would love it if people were equipped to be able to respond in charity, not to be afraid of it, not to think it's weird, not to think, that if a mental health need arises, to be able to respond in love.
Right, and this seems like a bit of a framework for that. Like what you guys are doing is kind of a scaffolding of, like, if something happens, like step 1, step 2, step 3, like kind of giving you a pathway to kind of move forward in some way to help. So
knowledge is power. I mean, we know that. So as much as we can equip people with the knowledge, they'll have the power to know how to handle situations and to know what to do. So that's I think our ultimate goal is just to educate people, give them the knowledge they need.
Right, and to empower the people that are serving in their church and in their church community, and even in their own lives, to advocate and empower themselves. So it's not like we have to come as you know, as these people doing the retreat to serve your community. We want to empower people that are in their community to serve themselves and their families and all of their parishioners. So.
Yeah. So did you implement the kind of what you were talking about earlier at BK?
Yes.
Okay, I thought so because I have kind of a success story about that. So it's kind of funny that
Please share.
it's kind of funny that you bring it up because I didn't realize that this is where this came from. But my daughter, who's now in college, when she was a freshman, she had a friend tell her that they were thinking about ending their life, and I think she told my wife, and my wife kind of figured out what to do about that. But I bet it was because of the program that you put in place, because my daughter knew right away what to do. And like you said, so as my daughter's friend, got really upset with her for about a week.
Yes.
And so it's kind of funny that you brought up like, yeah, they might be mad at you, but at least they're not, gone. And it was really funny, like looking back on it now, because I knew what was going on, of course, because my wife was telling me what was going on. But it's interesting that little, here's what you can do if you find out about this. Tell someone that you trust. It's more important than just brushing it off. Even if your friend says, don't tell anybody, because I know for a fact that this girl told my daughter, don't tell anybody, but I'm thinking about da-da-da-da-da. And then it all worked out the way it was supposed to, and she's doing great. My daughter's off at college, and this girl's off at college too. I don't think she's at the same school, but anyway, so it is working. It does work.
Good. And it did start at St. Mark's in 2015. That was our pilot.
Okay.
And it's still going there, and then followed up with at Bishop Kelly. So hopefully, yeah.
Yeah, I think Elena was a 9th grader. She wouldn't care if I said her name. And if she does, too bad. I'm her dad. I get to embarrass her.
That's right, yeah. Well, thank you for sharing that, because it is super important.
And Cari and I also did recently a SOS, Signs of Suicide program at St. John's for their youth group as well. So, there's a number of kids who don't go to Catholic schools that aren't getting this information. And so we did it at a youth group, and I think it was pretty successful. I mean, we had a few people we had to kind of follow up with that were having suicidal ideation. And so we identified those people and got resources for them. But it's possible to do it at a parish as well, at a youth group or something like that. It doesn't have to be at a Catholic school.
Right, yeah. So this curriculum is for school, but it meshes perfectly into church and religious education groups.
So catechesis, catechetical leadership, folks could definitely benefit from it.
And to give this program, you do not have to be a licensed professional. You do not have to be a nurse. It comes with guides and how you should, and I definitely have opinions about how it should be, because you need to follow up with about 10 to 15% of the students that are taking it. So you need to be prepared with counselors that are there, but to actually get the program, you don't. But you need to have resources, and there's kind of a whole canned program. So
that's cool.
Yeah.
What are the costs around it? Or is
I
it...
believe it's about $500 a year per building. But I know that there are grants and there are scholarships available, if they aren't able to get that into the budget. And Saint Al's, the hospital that I work for, we've been able to write grants to the foundation, and they have been extremely generous when we've needed to fill the gap. And now, actually, because we've been so successful, and I tell my story, and I keep statistics, and I keep numbers, aggregates, and tell stories, just like you had mentioned. There's several stories, and kids are younger and younger that we're finding, and so we've been able to actually have that in my budget now for, so you can partner with hospitals or other healthcare institutions around, and so there are ways to make it happen if you really want to make it happen.
So if you're in North Idaho and you want to go to this, is this your inaugural event? Like, this is the first one you've ever done?
Sort of.
We our very first one was at Holy Apostles of 2022.
Of the SOS training? Or
No, of just
we
this
do?
mental health retreat
Oh, okay.
concept.
We did a a one-day mental health retreat for
Yeah.
parish staff
Okay.
Yes.
specifically. And then we did one in Pocatello as well,
Mhm.
just for parish staff.
Gotcha.
Not for the general public. So this
Right.
is the first time we're including kind of the general
Yeah.
public. And the format's a little different than what we did before, but
Awesome.
Yeah, a little more intense.
yeah.
In a good way.
In a very good way, yes.
Yeah, giving you all the resources,
Yes.
more thorough, not intense.
Yes.
Intense
Yeah,
is-
and adding the Thomistic psychology, and
Yeah.
I think is going to be just wonderful.
So, are you going to speak at Holy Apostles tonight? Is that?
At St. Paul's.
Oh,
in
St.
Nampa.
Paul's. Okay,
Yeah, there's a 3-night retreat that I'm
Okay.
doing there.
super. That'll be fun. Well, so if I wanted to sign up, can I just come to the door? Like, do I have to go? What do I have to do to go?
I believe they have to go to the Eventbrite page and get a ticket that's free, but
Okay.
so we know the numbers.
Gotcha.
It'll help us with, especially
that's-
with the staff, because we're providing breakfast and lunch, so we need to know the numbers. So
Right.
I believe they go to the Eventbrite page.
They can call
The parish?
Call
St.
St.
Thomas?
Thomas.
Okay.
Yeah, so it's on the website.
At St. Thomas?
I don't know if it's on the website at St. Thomas. It should be. They should have a link there. We'll make sure it is. How about that?
Well, so it's on
um,
Eventbrite though?
It's on Eventbrite.
And
Okay,
it's on
I'll-
the diocese webpage as well.
Okay, there we
Okay.
go.
Okay, so we have multiple places that you can sign up. I'll put a link to the whole event on the podcast and on the video. That way, if someone needs to go and find out more information, it sounds like it's an RSVP free event. They can do that at the Eventbrite link at the bottom. So thanks so much, all of you, for coming, and good luck with your mental health endeavors. And if there's anything we can do to help you, please let Jay and myself know, and we'll be happy to help.
Whether you or a loved one are navigating mental health challenges or simply seeking to understand the connection between faith and emotional well-being, this event is for you.